Bismillah. So I'm going to talk about quickly thyroid FNA histological changes. You have an acronym WAFT. Worrisome histologic alterations following fine needle aspiration. So fine needle aspiration is where following fine needle aspiration is just FF and of the thyroid. Yeah, fine needle aspiration of the thyroid. That's it. Worrisome histologic alterations. Worrisome histologic alterations following fine needle aspiration of the thyroid. Easy. So what happens? Because FNA causes trauma and repair changes, of course, will happen. You will have hemorrhages, granulation tissue fibrosis, hemosiderin, probably follicular epithelial atypia. The important word is epithelial atypia. Follicular epithelial atypia. You should stay away from the FNA sites. That's the idea. Necrosis, inflammation. So what's the problem? It can mimic malignancy. So you don't want to just say, this patient has a malignancy and all of the tissue is normal except on the area that the FNA was taken. And you should know that this area of the FNA was taken in because you should follow where the FNA was taken from the previous biopsies and stuff like that. So the problem is, of course, you're gonna have nuclear enlargement, which should, strike you. The other things, because it's the thyroid, probably not the nuclear enlargement that will strike you, but more of the irregularity, the grooving and prominent nucleoli, grooving changes, irregularity, probably the enlargement. So you should make sure that you know these changes. So foamy histiocytes, you'll see them. So you have this histiocyte, yeah, and it's just cleaning here. Okay, and then you have hemorrhages. Your hemorrhage is a good sign there. And hemosiderin, yeah, sidrophage, yeah, it's hemosiderin. Multinucleated macrophages, there is giant cells. So yeah, multinucleated macrophages. And this is fibrosis. If you see fibrosis, this is not a follicle. This area is not a follicle. Why? Because it's paler eosinophilic area. And maybe you can see these things that are in there. This is just fibrous tissue. This is more pink. This is less pink. More towards the whiter color, paler. Lots of hemorrhage, probably a good amount of fibrosis if we look on higher power. And you can see that this probably was the needle as big as this. I doubt that, but probably yes. It probably was as big as that. Probably there is a good amount of multinucleated giant cells in here. Fibrosis, maybe, not too sure. This is fibrosis. This is a good fibrosis. If you see this, I think maybe he was stabbed with a needle in here. Okay, this is also fibrosis. I think that there is an amount of necrosis in here. Probably there is necrosis in here. Not too sure. Microfollicles. Is that what it is? Follicular epithelial atypia. There is something else called microfollicles, but I don't know. I think this is follicular epithelial atypia. Just saying. Yeah, this is another one. So you see giants. They do not look like papillary, the changes in papillary thyroid cancer, but yeah, so they do not have the intranuclear inclusions, the Anu, Orphan Annie eye, which is basically clearing inside of it. Grooves, maybe. Not really. I don't really see grooving. I don't see grooves in here. Yeah, that's it. Thank you.